available. Oh, good. Hey, Zach, are you on? Hi, Cecilia. I wanted to chat. Let me see. Which live auction would I go on and live video? Okay, I think I'm on live still with you guys. Hey, Jeff. I wanted to chat a little bit about this book, The Longevity Diet, which is by Professor Longo at USC, who has a lot of research and data that he has compiled over the years specific to longevity. So at USC, they have what's called the Longevity Institute. And the purpose of that is simply to study what contributes to longevity, what contributes to why some people live longer than other people. As you know, when we talk about like intermittent fasting and keto and all that stuff, or the other types of diets and health programs out there, the ultimate question we ask is, why are we doing this? Why are we on, why are we intermittent fasting? Why are we on this diet, that diet, and why are we even exercising? And I think the ultimate aim for most of us is, I guess, two things: health, to be healthier, and hey, Natalie, and secondly, really to talk about living longer, but not just living longer with sickness, but living longer with longer health, right, is the whole point. Hey, Sheridan. And so I wanted to, over a series of Facebook live sessions, really talk about and dig into the data that's been presented to us about longevity. Because I think ultimately everything that we do in health, whether it's diet, exercise, or taking meds, again, it boils down to the ideal goal of living healthier, but living longer as well. And hey, Vanessa, welcome. So I found out some really interesting things that over the last 10 days, hanging out on vacation with the family and going through this book here. Some things that kind of put a lot of the pieces together on is the ketogenic diet a healthy diet? Is it a bad diet? Does it contribute to longevity? And there are even different versions of this diet, right? The ketogenic diet and intermittent fasting and all that. But here's the point that is kind of like a paradigm shift that I've kind of uncovered, is that in medicine, when you go and you see your doctor essentially treats the symptoms that are in front of you, right? If you have a cold, they treat the cold. If you have a rash, right, Natalie will take care of your rash. And if depending on your symptom, you get a diagnosis and you get a treatment plan. Oftentimes it's a prescription, oftentimes it's a referral, or oftentimes it's more workup, like doing labs and things of that sort. Hey, David. And in medicine, we are used to essentially addressing diseases, right? We make a diagnosis and we treat disease. The whole point behind longevity is to get in front of these diseases and to discuss the different factors that contribute to aging and that contribute to diseases overall. So we are born here at this point here, right? And we go through life, and here we are, 10 years old, 20 years old, 30 years old, right? 40, 50, 60, 70, 80, and then we're dead, right? One long curve. Imagine a curve of your life. You start here at 0, you get older, and somewhere you hit midlife, and then it goes downhill, right, with aging. And over here you die, whether you're in your 80s, your 90s, whatever it is. And here's the thing with longevity and disease prevention versus disease treatment is that when you're here and you're in your teens, your 20s, your 30s, I mean, who ever thinks about, hypertension, diabetes, cancer, and things of that sort, right? Until we get to maybe our 40s, 50s, 60s, 70s, 80s, and that's when all the diseases, they kind of add on exponentially as we get older. So in your 50s, it may be just high cholesterol and hypertension, right? In your 60s, it's high cholesterol, hypertension. Now it's diabetes. In your 70s, you add on all these diseases and a heart attack, and then you add on, and then you add on cancer. So diseases exponentially increases associated with aging. As we get older, we just add on health conditions, right? That goes along with that. And we just assume it's normal because the older you are, the more pills you take, right? If you're 80-year-old coming into me, you probably got a list of 10 meds. And if you're 30 years old, you probably aren't taking any meds, right? We add the meds on as we get older. Let me ask you a question. If we were successfully able to cure cancer and we took away all cancers, right? How much longer would a person live if we took away all cancers? Does anyone know? Take a guess. Type in your comments what your guess is. How much longer the average American will live if you took away all cancers and cured all cancers, right? Take some guesses for me. I want to see what your thoughts are. If we cured cancer, how much longer would the average American live? Would they live an extra year? Would they live an extra 10 years, 20 years, or whatever that is, right? Lori says 30 years. An average American would live another 30 years if we took away cancer. Very cool. You're pretty optimistic there, Lori. And so if you study epidemiology and you look at all cancers in America and you look at lifespan that's associated with cancer, right? The facts are, if we took away all of cancer and we cured cancer, Sheridan says 15, 20 years, right? If you took away all of cancer and you cured cancer, the average person will live an extra 2 years, right? The average person will live an extra 2 years. That is it. That is it. Why is that? Because if you're in your 70s and you got diabetes, hypertension, high cholesterol, heart disease, and then you add on cancer, right? You got 5 diseases in your 70s and 4 diseases, and you add on cancer. If you cured cancer, you'll live another 2 years because one of these other 4 will get you, right? You'll get a stroke or a heart attack or something else, right? Or diabetes will get you. So if we cured cancer, the average American will actually only live another 2 years. If you cured heart disease and you took away all heart attacks, right? You took away all heart attacks, how much longer would Americans live? You guys know? If we were able to cure heart disease and we unclogged all the clogged arteries, and any thoughts on how much longer the average person will live if we took away all heart attacks? Any guesses on the comment section with that? And so The answer is this. Right? Lori says 10 years. Very cool. So here we are, right? We're born here. We're 10 years old. We're 20 years old. We're healthy. We're 30 years old. We're healthy, right? Vanessa says 5 years. We're 40 years old, right? We may have some high cholesterol, obesity, whatever. We're 50 years old. Now we got high cholesterol, obesity, and right? And you know, skin disease or whatever it is, right? So, and then we're in your 60s, your 70s, you're adding on disease. If you took away all heart attacks, the average American will live an extra 2 years. Why is that? And this is based on epidemiology studies. The average American will live an extra 2 years. Why is that? Because if you got 5 or 6 diseases on your list and you took away all heart attacks, right? Let's say you got 5 diseases, including heart attack, and you took away heart attack, you'll live an extra 2 years because one of these 4 over here will get you. One of these 4 over here will, one of these 4, right? You'll either get a stroke, or diabetes will get you, or Alzheimer's will get you, or cancer will get you, right? This is why if we only focus on treating diseases, we are actually not extending longevity, right? Yes, Sheridan, you're seeing a pattern. If all we're doing is treating diseases, we are not extending longevity, because the deck is stacked against you as you're older. If you got 5 to 10 chronic diseases and you cured 1 or 2 diseases, the other 8 will get you. That's why you live an extra, 1 or 2 years or 3 years. You're not extending your life, for another 10 to 15 years or 20 years, right? So the question is, do we wait? Do you wait till you're in your 60s, 70s, and 80s, and you try to pinpoint down the diabetes, you try to address the heart attack, the cancer, the melanomas, the skin conditions over here, one at a time? What are we actually achieving, guys? When these diseases are stacked against us and you take care of 1 or 2, right? What are you actually achieving? You may extend life for another few years, and that's it, right? But the problem is, that's where medicine is at right now. Medicine is designed to address specific diseases, to make specific diagnosis, right? So this whole idea of longevity is this. If you are here and you have a certain health metabolism, you have a certain genetics at work, and you have specific processes at work when you're in your 20s, 30s, and 40s, and you're not worrying about, catching or developing diabetes, hypertension, high cholesterol, obesity, Alzheimer's when you're in your 20s, 30s, and 40s. But all these diseases come on later in your 60s, 70s, and 80s. The idea of longevity is not about treating these diseases later on in your 60s to 80s. The idea behind longevity is what can we do to bring our state of health to that state of health of where we were in our 20s and 30s. Does that make sense to you guys? Instead of treating specific diseases, Alzheimer's, cholesterol, diabetes, right? Heart disease, and only extending life for an extra few years because something else gets you, what can we do in science to take our body back to where we were when we were in our 20s and 30s with that metabolism, right? Why is it that a person in their 20s and 30s or a teenager, why is it that their body doesn't even worry about developing hypertension, high cholesterol? Not that they don't have hypertension, high cholesterol, right? That's certainly possible when you're young, but they don't worry about these chronic diseases like heart disease, Alzheimer's, and stroke when you're young. What is it about the physiology of a young person where they don't even have to think about that? Because if you're in your 30s, right, you're going to live statistically to at least, another 30 years to get to your 60s, right? When you're in your 30s, you're going to live to your 60s without even worrying about health conditions. What can we do, and what does the data show that is needed to get that body into a body or a physiology of a person in their 20s and 30s? That is the science behind longevity, right? That's the longevity with that. And so I'm going to review for you a few different things of how the data was collected and the types of data that was collected to make certain conclusions on what we can do to get our bodies back to the physiology of youth, right? The physiology of a young person is different than the physiology of a person in their 80s, right? What is that physiology of a person in their 20s and 30s? And how is it different from that of a person in their 70s? If we all have the same bodies, we have cells and DNA and all that, why is a young person, right, not even worried about chronic health diseases compared to somebody who's older? And this is where the data comes in, right? The first there's 5 pillars of longevity, and each pillar looked at a specific type of data set that is used to draw certain conclusions. And so I'm going to tell you what these 5 pillars are, okay? And this is a really good lesson because I'm actually looking at the book to try to teach you guys these different things. And if there's a graph, this is so scientific. I'm just gonna like show you the graph. If there's a graph, right? I think Sheridan, this is not what Iman teaches, right? Iman doesn't teach like, here's the data, look at this. But anyway, this is just Dr. Iggy's teaching style. So let me go through with you guys the 5 pillars that is looked at to address conclusions on longevity with that. And let me pull it up here in between like people texting me and things of that sort. Pillar number 1 that's used is taking data from basic research on longevity. Basic research on longevity, there's actually a name to it, is called juventology, is the study of youth, right? And so juventology is the study of youth. And so Dr. Longo's lab have done a lot of studies specific to basic research. He have studied basically rats, mice, yeast, and created health conditions to rats, mice, and yeast to determine what types of condition allow a yeast to live twice as long as another yeast, or what type of health conditions allow a group of mice to live longer than another group of mice. So that study is called basic research or juventology with that. Pillar number 2 is epidemiology, where we looked at groups of folks through different countries and And we looked to see their lifestyle, their nutrition, and how long they lived. Did you know that there are groups of folks in southern Italy where people live to 100 years easily? We've heard of Japanese have one of the longest lifespans. They reach 100 years pretty easy. Ecuador there's another group in Ecuador who get to 100 degrees, not 100 degrees, 100 years easily. And even Loma Linda, not too far away from here in Southern California, the Seventh-day Adventists have historical long lifespan. So in epidemiology, we look at these groups to determine what are their lifestyles and why do they live longer than the rest of us, right? With that, hey Jen, hey Mark, welcome. So the study of epidemiology is the second pillar that's looked at. The third pillar that's looked at is the study of, is looking at clinical studies, clinical trials. Clinical trials done both in human, double-blinded clinical trials often, and clinical trials that are actually done in preclinical, which is mice and rats, to study longevity and why folks live longer. Hey Debbie, welcome. The fourth pillar is the study of centenarians, those who live over 100 years old. And there are pockets of folks throughout the world where they live easily close to 100 or over 100 years old. And so we went and we studied those folks. These patients or these people live in what we call the blue zone, right? And again, it's Ecuador, Costa Rica, southern Italy, Japan, Okinawa specifically, and Loma Linda, right? What is it about them that allowed them to live so long? And lastly, the last pillar is the studies of complex systems related to aging. And I'll explain that to you guys in a bit. So from these 5 pillars, from studying epidemiology groups, from looking at juventology studies or the study of youth, and looking at those who live centenarians, and looking at clinical trials and complex processes, they took all these 5 different pillars, they looked at data of these 5 different pillars, and put together a consensus of what it takes to live a long time. And to live with health. So I'm going to quickly go over a few things here that is neat. Number one is they've concluded, at least in basic research, they concluded that eating animal protein shortens your life. Pretty crazy, right? I'm talking about meat. The only exception to the rule, based on the data, has been fish because of the omega-3 fatty acid that is in fish. Hey, Ken, welcome. And so there's consistent studies showing that if you are a meat eater, your risk of death or your lifespan in general shortens compared to a vegetarian. We know in the Loma Linda studies, where the Seventh-day Adventists who live out in Loma Linda in Southern California, they're mainly vegetarians, and on average, sorry, Jen. On average, those who live a plant-based diet lifestyle, especially in Loma Linda, they live 7 years longer than the average American. So they've added 7 years to their lifespan compared to an average American. And here's the research why that is. Meat essentially activates two hormones in your system. One is called IGF-1, which is insulin growth factors, which is connected to essentially aging and cancer. So IGF-1, those who have a high IGF-1 level, which is consistently linked to animal protein, basically it speeds up your aging process is what happens. And along with that, all the age-related diseases go along with eating meat. So there's two promoters. One is IGF-1. The other one is called TOR-S6K. TOR-S6K is another hormone process that essentially causes and promotes aging and promotes. Ken says so much for keto then. Yes, Ken. That's well, Ken. I'll explain the keto part to you. But eating meat is related to chronic diseases and to an early death. Okay, so that's the first conclusion from basic research. Let me show you a graph that is connected to that, so that and if you guys have questions or thoughts, put it in your just put it in the comment box, okay? So we can discuss that. But here is the 5 pillars of longevity that I've discussed: epidemiology, basic research, clinical studies, centenarian studies, and the study of complex diseases. Right? I hope you guys like my my fancy presentation there. Laura, did they make the same conclusion with eating dairy? The answer is yes. So let me pull over the belief and the data that shows that if we cured all cancer, if we cured all heart disease and diabetes, if we cured all 3 diseases at once, diabetes, heart disease, and cancer, right? How much longer are we extending the life of a human being? And the answer is we cured all 3, we will extend our life by 12 years, okay? But if we address aging itself, right? If aging itself was a disease and we were able to address aging itself, how much life extension can we create, right? Based on the data. And the answer is 30 plus years. The answer is 30 plus years. Let me show you. Sheridan says, extend life about 7 years. Are these good quality of life for years? Yes, the answer is, in many of these centenarians who live a long time, right? They get to 100. These are generally good quality of life. And they get old. They don't have a lot of diseases. And all of a sudden, toward the end of their life, everything just kind of collapses and then they die, right? As opposed to living old with a ton of chronic diseases that adds on to that. Here is the graph that shows the data. And one of these days, I'll actually get it on like a nice PowerPoint slide for you guys that shows the data between 12 plus years versus 30 years. It's not all that clear with that. But so the solution to this, guys, is not to cure one disease at a time. The solution is not to cure one disease at a time. The solution to this is what are the factors that take you to a lifestyle that brings that physiology of a young person back, as opposed to the physiology of an aging person, right? Because if I can take your physiology, whatever your age now, right, and bring that physiology back to a physiology of a person in their 30s, I've added 30 years to your life. Make sense, guys? As opposed to curing your heart disease or your cancer or your Alzheimer's. So that's what the study of is about, of longevity. Now, here's some other data I wanted to let you know. Sugar consistently in basic research has been shown to promote inflammation. And what that means is that, I think in one of my lectures, one of my videos earlier in our sessions here, when you have too much sugar on board, the sugar is used for your body's energy. But when you have too much sugar, that excess sugar does damage to your body. It goes to 3 different places. The first place it goes to is that it deposits in your liver in the form of glycogen and causes what we call fatty liver. And fatty liver essentially is becoming a leading cause of liver transplant and liver failure in the United States. I don't know what Canada's like, Ken, but in the US, fatty liver, which is caused by too much sugar, causes liver failure. The second place that sugar goes to is that it goes into our fat cells and it makes us fat. So the obesity epidemic, which is an epidemic in the United States, I'm not sure about Canada and obesity, but in the United States, the obesity epidemic is basically driven by sugar. The excess sugar goes into our fat cells and it makes us fat. So when we think about obesity, most of us think about low-fat diet, right? If you want to lose weight, low-fat diet, lose weight, low-fat diet, I'm too fat, low-fat diet. But the truth is this, it's not the fat, it is sugar that goes into the fat cells and creates obesity. And obesity in itself is connected to cancer. Obesity is linked to diabetes, to hypertension, to high cholesterol, to Alzheimer's, right? It just creates all these other diseases. And that's the problem with obesity and overweight. And again, it is driven by sugar. Third place that sugar goes to is that sugar binds to the other proteins that are floating around in your blood. You got red blood cells floating around, you got white blood cells, you got molecules and proteins floating around. So the sugar binds to the proteins that are floating around in your bloodstream, and it creates a sugar tail, right? In medicine, we have a name for it. We call it advanced glycation end products. Advanced glycation end products is the name we use for it. And the reason these sugar tails are not good for our system is that our immune system, which is designed to look for anything that it doesn't recognize that's harmful, such as a virus, a bacteria, a toxin, the immune system attacks it, right? Anything that shouldn't be in your body is attacked by the immune system. And then the process of your immune system attacking things it doesn't recognize, it creates inflammation. And inflammation is the core of most of the diseases we have today, right? From all the skin disorders that Natalie takes care of, we have by the way, when I say Natalie, we have our dermatologist on board here listening in. Right from eczema to psoriasis, and all the different skin conditions, they're mainly inflammation induced, right? Most of the diseases we have are inflammation disease induced. If you look at the diseases of our lungs, asthma is simply inflammation of your lungs. Emphysema is inflammation of the alveoli sac, right? Bronchitis is inflammation of the bronchial tubes. Heart disease starts with inflammation, right? Many of us, when we think of heart disease, we think of clogging of the arteries, plaque production and all that stuff, right? But the reality is, the reason the plaque even forms on the lining of your artery, right, The reason plaque even forms on the lining of the artery is because the lining gets damaged, right? The lining of the artery is called the intima. When the intima gets damaged, then cholesterol plaque binds to it and clogs up your artery, initiating heart disease. The question is, what causes damage to the artery lining? The answer is inflammation causes damage to the artery lining. So why am I talking about inflammation? I'm talking about inflammation because too much sugar binds to these proteins floating around in your bloodstream, creating sugar tails. The sugar tails is not recognized by your immune system. And so as a result, the immune system is attacking these sugar tails. And in the process of the attack, it creates inflammation. And as inflammation is created, we get chronic diseases, right? From Alzheimer's to Parkinson's to heart disease, right? To cancer, which is driven by inflammation. It all boils down to sugar. And when I talk about sugar, I'm really just talking about the American diet, right? I'm not just talking about ice cream, cookies, cakes, and dessert. I'm really talking about bread, pasta, rice, potatoes, spaghetti, right? Hamburgers. Everything is carb related in the American diet. I don't know about what the Canadian diet is like, but the American diet is like filled with carbs. And I'm talking about specifically the simple carbs that break down the sugar, right? Not necessarily the complex carbs, which is from a plant, which is okay. But when we eat carbs, the simple carbs, it breaks down the sugar. It creates sugar tails, which creates an immune system attack to these sugar tails, which creates inflammation, chronic inflammation, which leads to the chronic diseases we have today, right? It boils down to the fact that we eat ourselves to our diagnosis, whether it's Alzheimer's or whatever it is, right? Hey, Jose. Hi, Susan. Hey, man. Welcome, guys. And so sugar is a culprit to longevity, right? We have found that sugar is a culprit. It makes cells vulnerable to damage, and it actually promotes cancer as well, because cancer cells grow at a faster rate than normal healthy cells, right? Cancer cells are always dividing, and which is why you get a mass, right? Like a breast cancer mass, lung cancer mass, brain cancer mass, fast division. To divide quickly, you need a lot of energy, and we feed it with the American diet, right? We feed it with sugar. So sugar is an enemy to longevity. Am I making sense so far, guys? How about that? Susan says, can damage to your arteries be repaired or reversed? If you catch it early, Susan, the answer is yes. So, two things that are enemies to longevity. Number one is protein, specifically animal protein, meat. Number two is sugar, right? They are both enemies to longevity. But now that you know that, you can adjust your diet, right? You can adjust your diet to address that. Because once you're able to address that, you minimize actually the aging process that occurs with IGF-1 growth hormones with that. Now, let me show you a study here of 3 groups of mice, what they're fed and how they are connected to longevity. And let me see if you're able to see this. Hold on. Whoa. Okay. You're probably not able to read it, so I'm going to explain that to you. But there's group 1, group 2, and group 3. And in the 3 groups of mice that was studied, they fed them protein and they fed them carbs. The first group of mice had a lot of protein but low carb. A lot of protein but low carb diet. The second group had low protein and high carbs. And the third group had low protein and high fat. So the first group, which is what I call the Atkins diet group, right? High protein, a lot of meat, but low carbs. The first group, they lost weight successfully, which is what the Atkins diet did. They did cut down the amount of food consumed, but they died young. So let me repeat that. Atkins diet, right? A lot of meat, low carb, no sugar. They lost weight and they died young in that group of mice, which I found pretty interesting, right? Because a lot of people are on that type of Atkins diet. The second group of mice, they cut down their protein and they ate a lot of fat. So it's a low protein, high fat type diet. So here's what happened to that group. They gained weight from all the excess fat. Their metabolic health condition got worse and they died young as well. The third group of mice was fed low protein, which meant they cut out on the meat. They didn't give animal meat, and they gave them a high complex carbohydrate diet, which is plant-based. That group lost weight. They increased their longevity, lifespan by about double. I think they lived about twice as long as the other two groups. So again, I can't conclude this in humans, but it's very interesting that those mice that were fed the Atkins diet actually ended up dead, although they lost weight. They died young. The group that was low protein, which meant they cut out animal protein and they did plant-based, live about twice as long as the group that did the Atkins diet. Very interesting stuff. What else can I tell you? Looking at epidemiology, guys, which is large population studies, right? To show the association between longevity and disease prevention. Those who live in epidemiology areas where, hey Talar, welcome. Those who live in epidemiology areas where they were kind of stuck to a plant-based diet and a low protein diet, meaning low animal fat, they lived longer. Those who ate a lot of animal protein, meaning meat, based on the epidemiology studies, they increased their IGF-1 level, and they had a 75% increased risk of overall death compared to a plant-based diet. They also had a 4-time increase risk of mortality from cancer compared to a plant-based diet, low meat diet person. So if you are a meat eater, what the studies are showing is that your risk of dying from cancer is 4 times higher than a non-meat eater. And your risk of death from any type of mortality reasons, right? Whether it's heart disease, cancer, strokes, whatever, your risk of death is increased by 75% if you are a meat eater compared to a plant-based eater. If your IGF level, which is something measurable, right? Insulin growth hormone, if your IGF level is high in the blood. And again, what drives IGF is animal fat, or no, I mean animal protein, right, is what drives IGF. If your IGF level is high, the data shows that you have a twofold or more increased risk for breast cancer, prostate cancer, and other cancers in general. So apparently IGF, guys, not a good thing to have. IGF-1, not a good thing to have in your blood at a high level. It drives apparently prostate cancer, breast cancer, and other types of cancer as well. Having a high IGF-1 level. And IGF-1, again, is driven by meat. Consumption of high animal protein increases cardiovascular mortality. And so very interesting what we're seeing in the epidemiology studies. And based on the blood that's drawn in these different groups of folks based on their diet with that. What else can I tell you about epidemiology? Certain populations with deficiencies of certain vitamins have been shown to have a increased risk for diseases as well. Did you know that vitamin D deficiency, when we think about vitamin D, the first thing we think about is your bones, right? Bone strength and bone density and all that stuff. But vitamin D is linked to a lot more other issues than simply your bones. I know that for a fact that we have 4 published clinical studies showing that vitamin D deficiency is linked to a higher risk of Alzheimer's. It's also linked to cardiac disease, diabetes, and autoimmune diseases. So vitamin D do a lot more than just taking care of your bones. Other clinical studies that's been shown, Mediterranean diet. If you don't know what a Mediterranean diet is, do a Google search. That diet is basically a plant-based diet. There's 10 types of foods in the Mediterranean diet. Green leafy vegetables, any type of vegetables, berries, nuts, grains, specifically whole grains, beans. See if I can remember this. I'm doing my own Alzheimer's test. Beans, fish, poultry, olive oil, and a glass of red wine, right? The Mediterranean diet, these 10 things I've mentioned, if you stick to it, we know for a fact, based on several published clinical studies, that it lowers the risk for heart disease and it lowers the risk for Alzheimer's. In one study that was published, the Mediterranean diet, those who stuck to it, lowered their risk for Alzheimer's by 54%. What we did was we took a group of patients and we put them on what's called the MIND diet, which is basically the Mediterranean diet along with the DASH diet, heart healthy diet. And we compared it to another group of patients on the American diet, right? We followed both groups of patients over time. And at the end of several years, we looked to see how many patients developed Alzheimer's from both groups. The group that was on this Mediterranean DASH, MIND diet had a 54% less chance of Alzheimer's than the group that was on the American diet. So pretty crazy what lifestyle can do to disease prevention and things of that sort. So Ken says, why are Asians able to eat such a high carb level and remain diabetes free? So Ken, in Asia, right? In Asia, we do a lot of rice. But in Asia, not everybody has a car. So they don't drive 5 minutes to go somewhere. Where here, I don't want to walk 10 minutes, so I prefer to get in my car and drive 2 minutes. So in Asia, they burn off their sugar. They burn off the carbs that they eat from their lifestyle, and they're also plant-based. as compared to Americans and Canadians, where we eat our carbs and it sits and it converts to all this sugar that doesn't get burned. So that's where the problem is, Ken, with that. Talara says, what kind of food have vitamin D? There's a whole bunch of food that has vitamin D. I'll get you a list. Lori says, I have increased my supplement vitamin D. Is there a good form? You have to show me what supplements you're taking, Lori, and I'll tell you if there's a good form. So let me tell you right now what kind of food has vitamin D in it. Mushrooms, fish like swordfish, trout, salmon, herrings, tunas, most types of fish. Orange juice that's fortified with vitamin D. Soy milk has vitamin D. Some almond milk has vitamin D. Sardines, salmons. The egg has vitamin D. Vitamin D is actually in the yolk of the egg. Shiitake mushrooms again. And basically lots of mushrooms, lots of fish. Talar has vitamin D in it with that. Okay, so anyway, IGF-1 is a consistent, which is an insulin growth factor driven by meat eating, and sugar is consistently, both of those are consistent factors that drives aging with that. What other studies are there? Centenarian studies have been done. So did you know that most centenarians, most of those who live to 100 years old or older, did you know that in the studies of their lifestyle, most of them only have 2 meals a day? Most of them only eat 2 meals a day. And so that's very interesting with that, because the studies are also now showing that those who go on the intermittent fasting diet, which is essentially a 2-meal-a-day diet, we're showing health results where we're burning our own fat, right? Most of us, I think in our group, are doing the skipping breakfast and doing lunch and dinner type fasting techniques. I think I just published something today, posted something today about the health benefits of that. So it shows that these centenarians are folks who eat mainly 2 meals a day. It also shows that these folks, these centenarians, eat their last meal before sunset. They eat their last meals before the sun sets. What that means is their last meal is typically 3 to 4 hours before bedtime. And again, the data shows that if you ate several hours before bedtime, there's less risk of obesity, there's less risk of health conditions, actually. And part of that, it just kind of makes sense that if I ate and I went straight to bed, right, all these calories from my meal gets converted to fat. I don't have the opportunity to burn that food I just ate. So it can get, so it creates all these sugar tails and things of that sort that's linked to chronic inflammation. So those who live to 100 years old, they have a particular lifestyle and they have a particular diet compared to the American diet. Let me tell you some differences between the diet of a centenarian versus the American diet. Americans eat 10 times more meat and poultry and eggs than a centenarian. So let me repeat that. Americans eat 10 times more meat than those who live to 100 years old or more. The second thing is that Americans eat 10 times less fish than those who have longevity, right? Like the Okinawans, right? Americans eat 10 times less fish and they eat 10 times more meat. Third thing, Americans eat 10 times more dairy products than a centenarian, than a person who lives to 100 years old. So we eat 10 times more dairy. I'm talking about milk. I'm talking about cheese, right? So we eat 10 times more dairy, we eat 10 times less fish, and we eat 10 times more meat. Okay. Next thing, next difference. Americans eat only half the vegetable content compared to a centenarians. So the amount of veggies we eat is only half, and the amount of meat that we eat is 10 times more. And lastly, Americans eat 1/3 less whole grains versus a centenarians. And the whole idea here behind whole grains is fiber, right? So we eat a lot less fiber, we eat a lot less vegetables, we eat a lot more meat, and we eat a lot more dairy. And so we die younger with that. So I hope that gives you some idea of a lifestyle of longevity. Here's another interesting graph showing heart disease among those who live in Okinawa. These are centenarians versus USA, America. And so the first two graph is males and females, or men and women. You guys see that big old long graph? This is a sucky presentation, guys. So that big long chart basically shows the difference in heart disease between Americans versus Okinawans, which is the dark colored on the graph, male and female. So female, male. So men and women, heart disease in Americans versus heart disease in Okinawans. Pretty crazy when you look at that data. Okinawans basically have fewer heart disease, fewer cancer, and they have 50% less dementia cases than Americans. They cut down their risks of Alzheimer's in half based on that type of diet. All right, let me see your chats here. Talar says, I'm Middle Eastern, eat so much veggies, yet my last lab was low in vitamin D. Yeah, more fish, Talar, with that. I would say 80% of my seniors have low vitamin D. It's quite scary, especially living in Southern California when we got sunlight, right? It's there's something wrong. It's kind of scary to see this level of vitamin D deficiency when we have noted that vitamin D deficiency plays a role in Alzheimer's, in heart disease, and in cancers and things of that sort, and autoimmune disease. Lori Roberts says, don't eat when it's dark. Yes. Ken says, I find intermittent fasting 19-5. So that means, Ken, you fast for 19 hours and you eat within a 5-hour window. It's much easier to adhere to than keto, and also lowers glucose if I exercise. Yep, Ken, 100% correct. Intermittent fasting, much more effective than trying to be on a keto diet. Intermittent fasting gets you to ketosis by burning your own fat. You don't have to worry about eating fat through this intermittent fasting stuff. You don't have to worry about eating meat and all that stuff. Intermittent fast, much more important than ketogenic diet. I'm not a fan of the ketogenic diet, by the way. Ken says my wife is going to live to 150 based on that diet. And she's going to drive you to the grave. Is that right, Ken? I'm just kidding. Hey, Vicky. Vicky just joined. Alzheimer's OC. Good to see you. So it's very interesting, guys. If I were to compare our body to a car, right? And that car needs all types of fluids to run. It needs oil. It needs brake fluid. It needs transmission fluid. And it needs gas, right? If your body is a car and your body needs all those different fluids to be efficient, right? Transmission fluid, brake fluid. It may just be you and me, Ken, who understand all this, because the rest looks like everyone on here is a lady, right? With all the car stuff. If you think of each fluid, brake fluid, transmission fluid, right, oil, if you think of each fluid in your body as a vitamin or supplement, right? So maybe the brake fluid is vitamin D. Maybe your transmission fluid is vitamin C, right? Or calcium. When one fluid level gets too low, the efficiency of the car does not run well and it starts to break down, right? It makes right? If you're losing brake fluid, then you can't brake well and the car doesn't run well, right? So let's say if you're losing vitamin D, right? Your car doesn't run well with that. Sorry, Lori. You know about cars. So if you're losing, let's say, transmission fluid because the level's too low, the car doesn't run well. And if you translate transmission fluid to another vitamin, right? Vitamin A, vitamin whatever, right? And that level is too low, your body doesn't run well. Makes sense? Different fluids for the car, for an efficient car, different vitamins and supplements for our body, for an efficient body to run. So the way I see this is that we need to make sure all of our levels are appropriately in a good range and not deficient, right? We need to make sure that all of the levels in our body, all the vitamins, vitamin A, vitamin B complex, vitamin B12, vitamin C, calcium, vitamin K, right? Those levels need to be good for your body to run in the same way that the different fluids of a car needs to be adequate for the car to run. If you have a deficiency in one of your levels, your body doesn't run well, you get diseases, right? Same thing with the car. But here's the thing, in America, we believe often that if you overdose or mega supplement on a specific vitamin, that it's going to cure this or that or treat this or that, right? And it's a fallacy because, for example, if I went and I overdosed on the brake fluid and I just kept adding brake fluid, right? And I top it out, but I keep adding more to it, is that going to make your car more efficient? The answer is no, right? And when you pump gas and it reached the max, but you keep pumping gas, believing that you're going to make your car much better, what's going to happen when you don't stop pumping and it's hit its max, right? It's just going to spill over. But we don't look at it that way when we mega dose ourselves with vitamins, right? Large doses of vitamin this, vitamin that, right? Large doses of this and that when we're thinking about vitamins to supplement. It's really the same process, guys. Megadosing a specific vitamin isn't going to cure anything, in the same way as overdoing a certain fluid in your car isn't going to make the car better. But having a deficiency will cause problems, right? So we got to be careful with the belief that megadosing on a specific supplement, whether it's, I don't know, whether it's turmeric or fish oil or vitamin C or B complex, is going to cure a certain thing. It isn't. It only helps when there is a deficiency, right? When there's a deficiency of the levels to basically help that car or help that body run a lot better. Okay? So what happens with this car is that the car gets older, and your car is 10 years old, your car is 15 years old, it starts to break down and leak. You take it to the shop, he fixes it, the leak. You go out, in a few months, something else leaks. You take it back to the shop, he fixes up the leak, right? You go out and you drive it, something else leaks. Same thing with our body, isn't it? When we get to our 70s and something breaks down, right? You're treating your diabetes, that's taken care of. You go home, you have a stroke. You know, a year from now, you treat that stroke, no problem. You go home, you have a heart attack, and then cancer comes on. Same thing with the car, right? Our body slows down in the same way that the car slows down. And all we do in today's treatment of health is that we patch up leaks. That's all we do, is we patch up leaks. What we really need to do is we need to find a way of how to get that car brand new again, right? As opposed to patching up leaks in medicine. And so, guys, it is 8:08 and it's late. So, hey, Melinda, right? It's 8:08 and it's late. So what I want to talk about next time is I want to bring to you the 8 different factors to get yourself a new car, as opposed to basically patching up the leaks in the old car, or to patching up the different diseases that we have as we get older. Okay, so this book goes through, right, what does the data show to get your new car? What does the data show that we need to do to, rather than patching up diseases when you're in your 70s, what can we do to bring you to that state of when you're in your 30s and 40s? That'll be the next lecture. Since I don't want to like go for 2-3 hours to talk with that. All right, let me see any other thoughts. Ken says, for the record, my wife is Filipino. Yes, which means Ken, she's the boss. Sheridan, which is why it's called supplements. That's right. Sheridan, what are my thoughts on, did I say I'm not a fan of keto? So, Merlot, I'm not a fan of the ketogenic diet because, one, I think no one can stay on the ketogenic diet long term. If you are a true keto person, all you're doing is eating fats, nuts, things of that sort, and you're avoiding any type of carbs, including fruits and things that epidemiology studies show is important for our health. So I'm not a ketogenic diet fan. I am a believer of the state of ketosis. If you can get to that state of ketosis, that's where all the health benefits are at. You can get to the state of ketosis through the ketogenic diet, or you can get to the state of ketosis through intermittent fasting. When you're intermittent fasting, you are burning your own fat, right? Because when you're fasting, your sugar is low. When your sugar is low, your body still needs energy. So it starts to burn fat. And when it burns fat, it creates ketones to create that ketogenic state, right? That ketosis state. So intermittent fasting is a better way to get to ketosis. than eating all the fats you want or eating meat and stuff like that in this ketogenic diet, because the data shows that that keto is definitely or especially animal-based proteins, which is part of the ketogenic diet, does not lead to longevity. It actually leads to a shorter lifespan and to an increase in cancer risks and things of that sort. All right, we're toward the end here. Yeah, I'm a fruit eater too, Talar, definitely. Dairy, I don't really do dairy, Susan. For two reasons. Dairy, the health of your dairy depends on the health of your cow, right? The health of your cheese, which comes from dairy, depends on the health of your cow. And in America, I don't know about Canada, in America, we pump our cows up with hormones, antibiotics, and chemicals, right? Into our cows, which comes through the milk. And that's why I'm anti-dairy, for those reasons. Yeah, if you are true keto, you stay away from beans. That's correct. Another reason I'm not really keto, because beans is actually on the good list. So you get to keto, Talar, through intermittent fasting. Vicky says, I'm not doing good keto diet, but I've increased my intermittent fasting from 16 to 20 hours, getting lots of leg cramps. Vicky, it means you need to hydrate yourself better. And it means, guys, when you're doing intermittent fasting and you're going, from 16 hours to 20 hours of fasting, really important to know a few things. The first thing you should know is that you should probably talk to your doctor first in case you're taking a whole bunch of pills to get their approval. The second thing is you need to hydrate. And the third thing is you need to make sure that you are not losing nutrients and vitamins from not eating well, right? Because Vicky, if you're getting cramps because you're probably losing potassium, you're not getting enough calcium, potassium, magnesium, whatever it is, right? That leads to the leg cramps because you're not eating a lot. So one trick around this, guys, is that if you are intermittent fasting, but you're worried about not getting the vitamins and supplements that you need, there's no problem about taking a multivitamin pill, either every day or every few days to supplement the fact that you're not eating at the same rate that you used to eat. So and the other thing is hydration, super important, right? Otherwise you get leg cramps and things of that sort. So if you're going the extreme, like some of us are, definitely make sure you're hydrating, make sure you got enough nutrients though, which means sometimes a multivitamin would be very beneficial with that to include in your intermittent fasting. Nothing wrong with a multivitamin, guys. Just not mega doses of something, right? All right, 8:15, guys. Thanks so much for being on here. Ken says, my doctor switched me to Metformin XR, so you can take my meds once a day so I can intermittent fast. You got a good doctor there. Very cool, Vicky. All right, I'll take a look at my schedule. Maybe next Sunday, if I'm free, I will go back on Sunday evening like what we normally do, and we will do part 2 of longevity, and we will talk about the 8 factors that bring your body back to its youth, right? How to implement this. And then we'll go from there. I'm glad you learned a lot, Sheridan. Okay, guys, I will see you later. Have a good week, okay?